My name is Stephanie McGilvery, and I'm the Department Chair and Program Director for the Physician Assistant Studies program here at the University of South Alabama. I am a physician assistant by training. A physician assistant is a licensed healthcare provider that practices medicine in collaboration with physicians. Physician assistants differ a little bit from the physician in what the complexity of the patients that we see day in and day out. We work in multiple arenas, such as a family practice office or even potentially helping a surgeon in the operating room. The biggest difference between a physician and a PA is the fact that we are dependent practitioners. We always work in collaboration with physicians, where physicians can work independently and treat patients without anybody else. We always work as part of a team. The typical physician assistant student starts their coursework by learning all of the anatomy and physiology in regards to patients, and then begins a clinical medicine series teaching them all the medical different conditions and diagnoses and treatment plans for different conditions. After that, it's usually followed with a year-long process of clinical rotations where they go out into different specialties working with other physicians and surgeons in medicine. Coursework would include anatomy, physiology, pathophysiology, pharmacology, maybe even along the lines of a clinical medicine course. Students will do clinical rotations in various settings such as emergency medicine, pediatrics, family practice, psychiatry, and even inpatient internal medicine. Those exposures allow them to work alongside physicians and other PAs throughout the day to see what it really is involved in patient care. After completion of all the coursework and clinical rotations and graduation, the student will then sit for a board certification exam before they can actually go out and practice. This test is usually taken within the first probably 8 weeks after graduation. Being a physician assistant has been a very rewarding career for me, and one that I would encourage high school and college students to pursue even today. I would tell them that they need to pursue a degree in any undergraduate field, but they will be required to get all of the science prerequisites, very similar to that of medical school. They will also have to take a graduate exam in order to apply to graduate school, since our degree is a master's level. And I would tell them to do extremely well in all of those courses, as the higher GPAs are the ones that the applicants get into the PA programs around the country. An additional thing that I would suggest to a young college student or high school student would be to go ahead and get some healthcare experience. Go ahead and try to find a job, whether it's part-time or volunteer hours, in the healthcare field so that you will actually know what you're getting into. One last thing I would add is for them to go out and shadow a PA. So the question you would have would be, where do you find a PA to work with? PAs work in all forms of medicine, so I would reach out to your local physicians, your local hospitals. Their credentialing offices can put you in touch with PAs who allow students just like you guys to come and shadow them.